I'm going to demonstrate the inexsufflator now in combination with some manual assisted coughing techniques. Peter's kindly agreed to assist us. He's just recovering from a pneumonia. Peter had C4 quadriplegia with paralysis of the left hemidiaphragm. So I'd like to talk about ideal positioning for carrying out this procedure. It's much easier if the patient is in supine. It's quite difficult to assist cough someone on their side, but you can do it if you need to. It's just hard to generate as much force if a patient is in side lying. So the techniques we're going to demonstrate today are going to be with Peter lying on his back. So it's important to prepare the environment, have clear space, be logical about the position your equipment is in, make sure that you're not reaching across the patient in order to control the machine and turn it on and off. So have the machine on the same side that you're standing on. And now, in order to get to Peter easily, I'm just going to move the bed out from the wall a little bit. Make sure the brakes are on the bed so that it's not going to move when we're pushing on his abdomen. Have the height of the bed low so that you can get your body weight over the top of the patient to make the task easier. And also it's good, if the person can tolerate it, to tip their head down so that gravity is assisting with the removal of secretions. You right if I put your head down, Peter? Comfortable there?
Yeah.
Now we're going to demonstrate use of the inexsufflator with Peter using a mouthpiece so that he can get good high pressures delivered to his airways and a really strong assistance on his cough. So I'll put the mouthpiece in Peter's mouth first. He can hold it with his teeth so I can have my hands free to turn to the machine and then to assist him with the cough. So if you watch the dial on the inexsufflator, you'll see the breaths being delivered. So here we go. Breath in and now breath out. Breath in, Peter's expanding, breath out. And you can hear him coughing. Thanks, Peter. You'll notice I turn the machine on and off when the mouthpiece is in Peter's mouth. If you leave it running, when you take it out, it'll spray into the person's face. Now I'm going to demonstrate some coughing techniques while Peter's using the inexsufflator. One person coughing techniques. Ready, Pete? Okay. Here we go. Breath in. Now we're just going to have a rest. The technique I was using then was a technique where you have a forearm over the abdomen and a forearm over the chest. It's important when coughing to just remember that you don't need a forceful thrust all the time. Sometimes just a firm compression can be very effective. So the technique is, ready, Pete? Mm-hmm. Here we go. Big breath in and again. Good. So I'm leaning with all of my body weight over the top of his body, and at the bottom of the compression I'm giving him a little bit of a shake, which helps to tickle secretions up a little bit further. If you get tired of doing this sort of technique, you can swap your hands around and cough like this. Ready, Pete? Again. And you can hear he's got some secretions that are moving up slowly there, and they'll come in a little while. It just takes a few cycles sometimes to shift the secretions all the way up. Now we're going to demonstrate a two-person technique. In all assist coughing techniques, it's important to remember if someone has fractured ribs, it's contraindicated to press on the ribs, same with a fractured sternum. If someone has abdominal trauma, it's contraindicated to press on the abdomen, also in pregnancy or any sort of unexplained abdominal distension, or in the presence of a AAA, an abdominal aortic aneurysm. None of these apply for Pico. If Peter had fractured ribs, we could press on his abdomen. If he had abdominal trauma, perhaps something like a liver laceration post a car accident, we could compress the rib cage. He doesn't have any contraindications to manually assisted coughing, so we can press on the ribs and on the abdomen to get maximum assistance with his cough. So you ready, Pete? Okay, go. Here we go. And again. Good, and relax. So the characteristics of the assist cough that it's important to note are: don't keep compressing the chest when the patient is breathing in, so come right off. When the patient coughs, have a fairly firm and quick downward movement for the cough. It's not necessary to thrust with the shoulder because that can lead to injuries for the person who's assisting with the cough. So this sort of repetitive movement is not a good idea for the operator. Using your body weight and being slow and firm are good ideas. And it's also important to, once you press in, stay there right until the end of the cough. Don't jump off too quickly. Okay, we're going to demonstrate a slightly different two-person technique now. So bow, just come in with the forearms, ready, Pete, and